Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Amirul Fahana di Rumah Makaman, and today I'm going to present my case study, my clinical thesis. The purpose of this case study is to identify the acute lymphoblastic leukemia on a 6-year-old male patient based on the clinical findings. The background and history of this patient is he is a 6-year-old male patient. He is well until 3 weeks prior to admission, and he has developed upper respiratory system, persistent headaches, bone pain, and easy bruising. Based on the physical examination, he had experiencing adenopathy on his submandibular, axillary, and cervical. Adenopathy is the enlargement of the lymph node. He also experienced hepatosplenomegaly, which is the abnormal growth of spleen and liver. And on his limbs and trunk also appear crustacean and bruises. This is crustacean and bruises, this is the pinpoint, and round spot. Here is the statistic. From the peripheral blood smear, it can be observed that red blood cell morphology, which can become normocytic and normochromic. White blood cell morphology, he has found that abnormal cells, size small to medium blast, fine chromatic pattern, one or more indistinct nuclei, and scanty basophilic cytoplasm. However, platelet morphology is with the normal limit. From the complete blood count, it's recorded that the reading for red blood cell is relatively low. However, the reading for white blood cell is relatively high. And also have abnormal cells shown. Further laboratory testing has been done, which is bone marrow biopsy. From the bone marrow exploration, the result has recorded the differential showed 69.1% blood similarities in the blood. And from the bone marrow sectioning shows, it is marked as hypercellular. Then, cytochemical testing also has been done. There are 3 types of stain used in this test, which is myeloroxidase stain, which shows negative result. Soda black B stain shows negative result, but however, pus shows positive result. Whereby from the result show intensive staining clumps in the cytoplasm. Furthermore, immunophenotyping also has been done. The marker that been tested is CD, which shows positive result, B precursor cell, which shows positive result, D precursor marker shows negative result, and myelomonocytic marker also shows negative result. Then cytogenetic test has been done. Cytogenetic tests provide information about the genetic makeup of the leukemic cells, in other words, the structure and number of chromosomes present. Chromosome changes are not usually passed down from parent, but it is acquired. In this case, it has normal chromosome, which has no numerical or structural abnormalities. For cerebrospinal fluid testing, a small sample of the CSF that surrounds the brain and spinal cord is taken via a needle in the lower back. The purpose of this test is to check for the presence of leukemia cells within the central nervous system. However, the result obtained from this patient indicate normal. This is the result. This is shown a clear colorless CSF. Glucose and protein is within the normal range. The RBC and WBC also normal, and the gram stain and culture also show negative results. Based on the result of the laboratory findings, it has confirmed that this patient has acute lymphoblastic leukemia type 1. Acute lymphoblastic leukemia is a type of cancer that affects immature lymphocytes developing in the bone marrow. In normal conditions, its cells grow and mature into specialized white cells called B lymphocyte and T lymphocyte. In this case, the lymphocyte is multiplied in an uncontrolled way and is quickly crowding the bone marrow and interfering with normal blood cells. This indicates the reading for lymphocyte is high, whereby the reading for the immunoglobulin is low. From the previous study by Cars 2010, acute lymphoblastic leukemia is the most prevalent cancer of childhood and accounts for 26.8% of cancer diagnosed among children worldwide. About 80 to 85% of children have B-cell acute lymphoblastic leukemia, whereby the leukemia are from the B cell. And about 20 to 25% occur in adults, and this is an onset condition. This is where the cancer starts at the common report originator. Diagnosing acute lymphoblastic leukemia requires a simple blood test called a complete blood count that marks low RBC count, low hemoglobin level, and low platelet count, high or low white blood cell count, and have abnormal leukemic blood cell in the bloodstream. And then for bone marrow examination, diagnosis of ALL is confirmed by the presence of an excessive number of blood cells in the bone marrow. In normal circumstances, the bone marrow contains only a small proportion of blood cells, which is less than 5%. The Sudan Black B and myeloperoxidase test result marked as negative for ALL. Patient marked as positive, whereby shown an intensely clump in the cytoplasm. QDT and precursor marker test result marked as positive result. However, there is no numerical structural abnormalities found during the cytogenetics, and a normal result obtained from the CSF. Therefore, the leukemic cell is absent in the central nervous system. Based on the French American British classification, for acute lymphoblastic leukemia, there is 3 types of ALL, which is type 1, type 2, and type 3. The characteristic is based on its morphology, which is size of blood, cytoplasm, entry ratio, cytoplasmic vascule, nuclear membrane, and nucleoli. This is the classification by WHO for acute lymphoblastic leukemia. This is the type of lymphoblastic leukemia with certain abnormality. For prognosis and treatment, the outlook for this patient case and for most children with ALL is very good, and certain prognostic factors give some children a better chance of being cured from their diseases with specialized treatment. There are a few types of treatment recommended for this patient. The first thing is induction therapy. Induction therapy is the first treatment given for all of diseases. Induction therapy consists of consuming multiple combination of drugs. After that, proceeds chemotherapy, and then bone marrow transplantation, clinical trial, and palliative care. Palliative care is a specialized medical care for people with serious illness. The aim for palliative care is to improve the quality of life for both patient and family. As a conclusion, this disease is curable if detected early. An appropriate and relevant diagnosing method are crucial in order to obtain an accurate and specific result for treatment and prognosis. Further research regarding ALL is crucial in order to improve locality and come up with cost-effective treatment. This is my references. Thank you.